I'm Amanpal Singh from University of Texas Medical Branch at Galveston. I'm one of the co-authors of our upcoming study in clinical gastroenterology and hepatology entitled Antiviral Therapy and Risk Reduction of Hepatocellular Carcinoma in Hepatitis C Cirrhosis, Review and Meta-Analysis. I'm going to present some of the highlights of our study. Patients with hepatitis C related cirrhosis are at an increased risk of hepatocellular carcinoma. Currently, combination treatment with pegylated interferon and ribavirin achieves a sustained virological clearance in 30 to 50% of the patients. Several reports have suggested that interferon therapy in chronic hepatitis C patients reduces the risk of hepatocellular carcinoma. Two independently published meta-analyses also showed reduced risk of hepatocellular carcinoma in hepatitis C patients with cirrhosis. Most of the studies included in these meta-analyses used interferon as a sole treatment agent. And moreover, response was defined based on biochemical markers, but not on sustained virological clearance. We performed a systematic review and meta-analysis to assess the efficacy of antiviral treatment in the risk reduction of hepatocellular carcinoma in hepatitis C related cirrhosis. We tried to improve the quality of our study by including the studies reported in the last 8 years since these meta-analyses were published. In addition, some studies have shown that interferon reduces inflammation and fibrosis in hepatitis C patients with cirrhosis, even in the absence of the clearance of the virus. Based on this observation, maintenance therapy with low-dose interferon has been evaluated in few studies with conflicting results. Hence, in the second part of our study, we try to evaluate the efficacy of maintenance treatment in risk reduction of hepatocellular carcinoma in hepatitis C cirrhosis. We searched for electronic database from 1991 to 2008 for studies evaluating the effect of antiviral treatment in hepatitis C patients with cirrhosis. The outcome of interest in these studies was development of hepatocellular carcinoma. We included studies which used pegylated or regular interferon alone or in combination with ribavirin. The response was based on sustained virological clearance, defined as negative HCV RNA 6 months after stopping the treatment. As the risk of hepatocellular carcinoma increases with the longer duration of the follow-up, we included studies with a minimum follow-up of 2 years. Collected data from the studies was analyzed using RevMan. If there was any heterogeneity found among the studies, meta-regression was performed. We shortlisted 83 studies, and out of those, 32 were selected for the final analysis. There were 9 randomized controlled trials, 15 studies were retrospective, and 8 studies were prospective. Since there is evidence to suggest that interferon reduces macroinflammation and improves histological activity in all treated patients irrespective of viral clearance, we first analyzed the data from 20 studies comparing treated and untreated patients. The pooled data showed reduced risk of hepatocellular carcinoma among the treatment group. However, this data suffered from significant heterogeneity to derive any valid conclusions. Then we analyzed the data from 14 studies comparing the development of hepatocellular carcinoma based on the sustained virological clearance. We found that patients who achieve sustained virological response are at reduced risk of hepatocellular carcinoma. There was no heterogeneity among these studies. But it remains concerning that about 5% of the patients who achieve sustained virological clearance are still at risk of hepatocellular carcinoma. The other main concern is the risk of hepatocellular carcinoma in non-responders. Pooled data from 4 studies comparing low-dose maintenance interferon treatment to no treatment did not show any risk reduction of hepatocellular carcinoma in the treatment group. The studies included in this analysis were good quality randomized controlled trials, and there was no heterogeneity among these studies. So to conclude, our study shows that antiviral therapy reduces risk of hepatocellular carcinoma in hepatitis C related cirrhosis. The protective benefit is maximum in patients who achieve sustained virological clearance. A small percentage of patients, despite achievement of sustained virological response, remain at risk for hepatocellular carcinoma. Hence, all patients with hepatitis C cirrhosis should continue surveillance for hepatocellular carcinoma. Secondly, non-responders continued on low-dose maintenance therapy do not get any protective benefit in preventing hepatocellular carcinoma. In future, the efficacy of antiviral treatment may improve as there are multiple newer antiviral agents including HCV protease and polymerase inhibitors in various stages of development, with higher rates of sustained virological response in both treatment naive and non-responder patients. Thank you.